Well, the number of COVID-19 infections are expected to rise in Gauteng. This as more people return from their holidays. The provincial government is yet to announce its readiness plan. Meanwhile, South African Breweries is taking government to court over the ban on alcohol sales. Heidi Giokos following both these stories for us. She joins us live. So Heidi, we'll start here in the province. How's testing going in Gauteng?
Yes, indeed, Shahan. It would have been we would have had a clearer picture, rather, in terms of what is actually happening in Gauteng now that holidaymakers are making their way back to the province. But unfortunately, the Premier's office cancelled the Provincial Command Council meeting that was supposed to take place today. That briefing was supposed to take place at 12 o'clock and it was cancelled at the last minute. But before that briefing was supposed to take place, we went to one of Dis-Chem's drive-through testing stations to get a sense of whether or not they're experiencing an influx and how testing is looking like. Are they managing the amount of tests coming through? And it started at about 9 o'clock this morning, and already there were cars queuing up to get tested with all the staff in the correct PPE to make sure that they can handle the amounts of people coming through. We also got a chance to speak to one of the head nurses at Dis-Chem, who indicated that initially during the first wave there were issues around PPE and nurses and staff finding it very difficult to adapt to this new testing routine that they had to get into, and now during the second wave they've managed to deal with some of the challenges that they previously had, but the numbers are enormous in terms of how many people are testing, record numbers that they've never seen before. Let's listen to what she had to say to us.
Just from the testing perspective, I mean, obviously, I think that's also a challenge in not just in South Africa but worldwide is healthcare workers. And from a Dis-Chem perspective, that's also sometimes a challenge because we also get sick. So we have all the PPEs, but they unfortunately do get sick. So that a challenge is the volumes, and especially in a peak. And we would love to do more testing, but the site cannot do the volumes. At a certain stage, we must say, sorry, it's enough, we can't help you. And then obviously from a pathology perspective, they cannot only do so much test per day and the results to come through in 24 hours to 48 hours, sometimes 5 days.
So to another story now, you've been going through the SAB court papers challenging government's ban on alcohol. What are the arguments?
Yes, indeed. Government has another court battle that it's expected to face. We understand that SAB, with a number of other applicants, have filed an urgent court application at the Western Cape High Court challenging the alcohol ban. SAB has clearly said in their court papers that the ban is unlawful and it removes the rights of South Africans to human dignity, privacy, and the right to bodily and psychological integrity. And basically what SAB is indicating is that they understand that government is trying to find ways to curb the spread of COVID-19, and while it supports the measures taken, it doesn't support the fact that the alcohol ban is the only solution. And just to put it into context, Shahan, this new level adjusted 3 that South Africa is in currently for the next 2 weeks, we understand that about 250,000 direct jobs in the alcohol industry are at risk. And from the previous 2 alcohol bans that we saw last year, we know that over 100,000 jobs were lost. So SAB is saying that government needs to reconsider its measures, and alcohol should not be the only measure that's been used and implemented to curb the spread of COVID-19. And this is why they have filed this urgent court application to say that it's unlawful, it's unnecessary and unconstitutional.
I'm suddenly parched, Heidi. That's all you're doing. So given what we saw with the application from British American Tobacco, are we likely to see the same outcome for SAB?
I mean, it's a good point, given the fact that FITA and British American Tobacco South Africa had the similar kind of argument to say that it takes away the right of every individual to make the decision on whether or not they can or can't smoke, or whether or not they can consume alcohol in the privacy of their own home. And it's going to be quite challenging for government in terms of both these these arguments, but specifically to say, how do you balance lives and livelihoods? And that's the big argument here. What is going to happen to the economy, but also the strain that we have clearly seen that alcohol has put on trauma wards, and how that strain was taken away on Christmas Day and New Year's when it was most expected because of what alcohol unfortunately does in this country. So we're not sure what the outcome will be, but it's on an urgent basis, and will most likely the court will come back to SAB in terms of a date.
All right, thanks for that, Heidi Giokos.